A patient came to me this week, visibly shaken. She'd read 3 news articles in 1 week about hantavirus deaths. She looked me in the eyes and asked, "Doctor, should I be preparing for another pandemic?" And honestly, I understood exactly why she was scared. Because the headlines about hantavirus have been getting louder. And after everything the world went through with COVID-19, it makes sense that people are on edge. But here's what those headlines aren't telling you, and it's the part that actually matters. Hantavirus is real. It is deadly. But the story is far more nuanced than the news would have you believe. In this video, I'm going to walk you through what hantavirus actually is, how you can realistically be exposed to it, why it is not spreading the way COVID did, what your true risk level is, and the simple steps that can protect you and your family. If this kind of honest, no panic medical information is what you've been looking for, I'd love for you to subscribe. Hit that button right now and drop a comment below telling me, have you been worried about hantavirus? I read every single one. Let me start with the basics, because a lot of people are confused about what hantavirus actually is. Hantavirus is not one single virus. It is a family of viruses, each carried by a specific rodent species. In North America, the primary culprit is the deer mouse. In South America, different rodent species carry their own strains. The virus lives in the rodent's urine, droppings, and saliva. When those droppings dry out and the particles become airborne, that's when humans are at risk. You breathe in those microscopic particles, and the virus enters your lungs. What happens next is what makes hantavirus so frightening. The most dangerous form is called Hantavirus pulmonary syndrome, or HPs. It starts innocuously. Fatigue, fever, muscle aches. For the first few days, it looks like the flu, but then, around day 4 or 5, fluid begins flooding the lungs. Breathing becomes difficult, then agonizing. The heart struggles to pump, and in severe cases, the body shuts down. The case fatality rate for HPSS in the United States is approximately 38%. That number is sobering, but it also requires context, because raw mortality rates without context are how panic spreads faster than the virus itself. Here's what I want you to understand clearly. Since Hantavirus pulmonary syndrome was first identified in the United States in 1993, there have been fewer than 850 confirmed cases total, across more than 3 decades. To put that in perspective, that is fewer cases in 30 years than some hospitals see of a common illness in a single week. The Centers for Disease Control confirms this. Hantavirus is rare. Devastatingly serious when it occurs, but rare. But here's the part most people miss, and this is critical. Hantavirus does not spread from person to person. Let me say that again, because it is the single most important fact in this entire conversation. You cannot get hantavirus from another human being. Not through touch, not through a cough, not through close contact. This is the fundamental reason why hantavirus is not, and cannot be, a COVID-style pandemic. COVID-19 spread because one infected person could infect dozens of others in hours. Hantavirus has no such mechanism. Every single human case traces back to direct exposure to an infected rodent or its contaminated materials. There is no human transmission chain, no exponential spread, no scenario where a crowded subway or a school cafeteria becomes a hotspot. The epidemiology simply does not allow it. Now, a researcher in South America did document a very limited cluster in 2019 where one specific strain, Andes virus, showed possible person-to-person transmission in a small number of cases. This finding was significant enough to take seriously. Scientists are watching it carefully. But even in that cluster, transmission was extremely limited and did not escalate. It did not change the global risk picture, and I will tell you plainly I am watching that research too. If the science shifts, I will tell you. So who is actually at risk? Your risk of hantavirus exposure comes down to one thing: contact with infected rodents or the spaces they inhabit. Rural populations face higher exposure. Farmers, hikers, hunters, people who work in barns or fields. But suburban and even urban risk exists. If you have a rodent infestation in your home, your garage, your shed, and you disturb dried droppings during a cleaning, that is a real exposure scenario. Cases have been documented in people who simply cleaned out a dusty cabin or moved boxes in an old storage space. And this is where I want to give you something practical, because I do not believe in leaving patients with fear and no tools. First, never dry sweep or vacuum rodent droppings. This is the most dangerous thing you can do because it launches particles directly into the air you are breathing. Instead, soak the area with a bleach solution, 1 part bleach to 9 parts water, let it sit for 5 minutes, and then wipe it up with disposable gloves and a damp cloth. Seal everything in a plastic bag and dispose of it properly. If you are dealing with a significant infestation, wear an N95 mask during cleanup. This is not optional. This is the difference between safe and exposed. Second, seal your home. Deer mice can squeeze through a hole the size of a dime. Check the foundation, around pipes, and under doors. Steel wool packed into gaps, followed by caulk, is highly effective. Snap traps work well indoors. Rodenticides can be useful, but require care around children and pets. Third, when you are outdoors hiking or camping in areas with high rodent populations, do not sleep directly on the ground. Keep food sealed. If you are using a cabin that has been closed for a season, ventilate it thoroughly before cleaning. Open doors and windows for at least 30 minutes before you disturb anything inside. These are not extreme measures. They are common sense steps that dramatically reduce your exposure risk. Now, I want to address something that I know is on many minds because I hear it from patients constantly. There is a broader anxiety right now. After COVID-19, after monkeypox, after every alarming headline, people are living in a state of low-grade pandemic dread. And I understand it. I do. But I also think that dread, left unexamined, can be more harmful than the viruses themselves. It drives people toward either dismissing all risk entirely or living in paralysis. Neither extreme serves your health. What I want for you, and what I try to practice in my own life, is calibrated vigilance. That means taking real risks seriously, proportionate to the actual evidence. Hantavirus is a real risk for people in specific exposure scenarios. It is not a real risk for the vast majority of people going about their daily lives in cities and suburbs. Knowing that difference is not dismissing the virus, it is respecting it accurately. Scientists and public health officials continue to monitor hantavirus strains globally. Surveillance has improved dramatically since the 1993 outbreak. We have better diagnostic tools, better supportive care in intensive care settings, though there is still no specific antiviral treatment approved for HPs. And early supportive care remains the cornerstone of survival. Research into vaccines is ongoing, and I am genuinely hopeful about the science being done right now. But let me be honest with you about something. The next pandemic, whatever form it takes, will most likely not be hantavirus. The characteristics that make a pathogen pandemic capable are well understood by infectious disease specialists: efficient human-to-human transmission, a long incubation period during which the infected person is contagious without knowing it, and broad geographic mobility. Hantavirus, in its current known forms, lacks the first and most essential of these features. That does not make it unimportant. It makes it a different category of threat, one that demands individual prevention, not societal lockdowns. What it demands from you is this: know your environment, control rodent access to your living spaces, clean safely if you encounter evidence of infestation, stay informed from credible sources, not panic-driven headlines, and trust that your body, combined with smart precautions, is capable of navigating this world. That is what medicine has always been about. Not fear, not false reassurance, honest information that empowers you to protect yourself and the people you love. If this video helped you see hantavirus more clearly, share it with someone who needs it. Leave me a comment below with your questions. I answer them. Subscribe if you haven't already, because I put out videos like this every week, cutting through the noise, so you can make decisions based on science, not headlines. Take care of yourself. I'll see you in the next one.